So the big words on the slide, consumerization of healthcare. I think that holistically as a theme is what we set out to address here. But I'll talk a little more specifically as to what that means within mental health as a category and how Awell is doing such a good job at helping us solve that. First, a quick bit of background on myself. I'm a director of strategy and growth. I've been within the company for a year. I've worked with them for 2.5 years in an investor role. Prior to that, I was a healthcare services investor, spent most of my time around behavioral health, and spent the earlier years of my career in investment banking, working predominantly with large health systems and value-based care providers. But let's get into Soul. So this is our at a glance, and it kind of illustrates who we are and where we're focused today. First and foremost, we're an outpatient psychiatry and therapy provider. So we employ psychiatrists, nurse practitioners, therapists, and we bill for care. We have 30 locations across the U.S., 5 states, over 200 providers. We do both in-person and virtual care. And this top right bucket here is really where we were focused. It's super important to nail the patient experience for behavioral health patients. And I'll speak more to in a moment why. Along with that, it's important to track progress. And so as opposed to physical health care, we can track things like, whether someone heals from a condition or their knee now works. It's a little tougher in mental health. So we focus on standardized scores like PHQ-9 and GAD-7 to track our version of quality-based care. We're all in network, and we're very focused on integrating with the broader healthcare delivery system. So not only taking referrals from PCPs, health systems around the industry, but also finding ways to be a helpful partner to them. So sharing information back to them, making sure we're able to confirm when their patients are in care and how many visits they did. So that's a real focus point for us in 2025 and beyond. And as we get to the end of our use case here with Awell, I'd like to elaborate more on what we're thinking about there. So taking a step back, just to do a level set on modern mental health care, the biggest challenge is still patient access. So I kind of bucketed 3 things here. One is really that, it's a unique relationship between the patient and the clinician. In mental health care, you're seeing your therapist every week or every other week, and on the psychiatric side, generally every month. So it's a much more frequent touch point than your general PCP or specialist relationship. And it's really important for patient retention, for quality outcomes, that you find the right quality of care and you find the right clinician. The second big prevalent dynamic in mental health is that patients are frequently motivated to search for care when they're in a moment of duress. So if you have the flu, you generally know you have the flu or something's wrong and you go to an urgent care. If you blow out your knee, you need to go see an orthopedist or a physical therapist. If you're feeling down, everyone feels down at some point. So it's often challenging for patients to figure out when is the right moment to jump into care. And then when they do decide that it's the right moment, they want to find care then. That's when they're most motivated. It's a tough decision to get into mental health care. And so patients need to be able to book an intake and feel like they're going to be taken care of at that moment. Lastly, the patient onboarding process and RCM just looks a little different for behavioral health. It's tough for patients, in a similar vein to know what part of the care continuum they should be seeking, right? You have general outpatient, which is low acuity. You have intensive outpatient. You have partial hospitalization. You even, might need inpatient psychiatric hospitalization. So there's a full spectrum of acuity. It's tough to know where you're going to land. And then on the insurance front, there's behavioral health carve-outs and plans. So it's a difficult front-end process to say, okay, this patient we can take, they'll be a clinical fit, and we know we're going to be able to bill appropriately for their care, and they're not going to face big out-of-pocket charges. So let's talk about what we've been working on with Awell. Effectively, what we built is a streamlined intake process that is rooted around an online booking tool. So again, patients are highly motivated to find the right clinician for them. So you can't just show them, who's first available. You can't just show them who's in their state. You have to show them, okay, am I looking for an in-person or telehealth appointment? Am I looking for a specific condition, because there's a whole range of conditions in behavioral health. Maybe you want a clinician that treats anxiety. Maybe you want one that treats ADHD. Maybe you've gone through a divorce and you need, marriage or family counseling. What we've done in the tool is we've attributed these values to all of our clinicians on the back end, and JB and team have mapped this into the tool so that patients have these nice filters. They can search for a specific clinical focus, they can search for a gender, they can search for an ethnicity, and find the provider that fits them for care. Again, it's an online booking tool. So this enables patients to get into care when they want to. Previously, what we were doing is we had a contact form, you'd submit your info, and we're going to call you back, get you scheduled for care. That's obviously not ideal. You're not reaching the patient when they are most motivated. And lastly, the way Awell is constructed with their care flows, for those of you that haven't spent time, it is highly dynamic and adjustable. What we're able to do is make sure we're taking the patient through the right clinical checks, collecting the exact right insurance information, and ensuring that the full intake and administrative front end is completely streamlined. V1 was not perfect. We didn't nail it. V2, we didn't nail it. We're now on V38. And, I think that speaks to how adaptable Awell's tool is and the live learnings, which I'll speak a little more to, that you're able to calibrate off of. So what are the results we're focused on in each of the key three buckets that I've kind of outlined here? I'm going to call out one area where we've seen success and one area where we're still tracking. We just launched the tool in November. So like WellPath, there's live learnings. We're still tracking KPIs and downstream impacts. But the first bucket that we're focused on, again, is patient access. And are we meeting patients where they want to be? So again, we're on version 38. There's a nice function within Awell's tool called flow path, where you could see at each step, we have about 30 steps in our care flow, in our scheduling process, some small, some big, but you're able to see exactly where patients are dropping off and adjust accordingly to those bottlenecks. We've been highly flexible on that front. And over time, we're hoping this is going to drive patient retention. If a patient finds a clinician that they want to see, ideally, they'll continue seeing that patient. And you'll kind of mitigate some of that drop off, or maybe there isn't a fit. In the second bucket, again, patients want live care. So we've booked 932 new patients. And we're hoping this is going to increase overall conversion percentage over time. So, if patients are more motivated to get into care, they're more likely to show up to their first appointment and stick with us through care. Simple as that. Thirdly, we're really focused on the administrative piece. So again, previously, we had to call a patient, in most cases multiple times, to try and get them booked after they fill out our contact form. Now, everything's captured in this online booking tool and workflow. We have their insurance info. We have their address, their registration info. This all goes into our Salesforce, and then our team clicks convert, and it goes into the EMR. So it's a very streamlined conversion that we've worked with the Awell team to set up, and it's saving our team a ton of time. Now, the bucket that I haven't talked much about yet is RCM. And, I think that's something that we're hoping this will impact over time. So if we're getting the exact right registration and nailing that on the front end, and we're able to check eligibility on intake, then this will mitigate a lot of our downstream RCM issues that we see, where registration, the address was slightly off because we weren't asking for, the primary policyholder's address, for example. And in Awell, we very clearly lay that out and can kind of force some logic to make sure the registration is done accurately. Lastly, where do we go next? I think we've been spitballing with the Awell team. They're very collaborative partners on what's in the future, what's possible, how do we best use care flows and CareOps to build out our full intake process. Intake isn't just about scheduling. And I've talked a little to those pieces thus far, but really, what's first on our list is integration with a third-party live eligibility checker. So as a patient inserts their insurance info at the end of the online booking process, there are a couple new startups in the space that we're looking at as vendors, and they can essentially tell a patient live, Are you eligible? B, at time of service, what will you owe for your copay? And C, if it's a high deductible plan or there's a risk of denials, it flags it internally. Um, the second use case we're thinking about is advanced patient referrals. And what does advanced patient referrals mean? It's a lot of what I described in our kind of vision and mission as Soul. It's really not only being able to take a referral from a doc. So a doc, in theory is maybe submitting patient information through the EHR, or they're submitting it through a form, and it's on us to go track that patient down and get them scheduled for care. All of that can obviously be automated within care flows and Awell. But what we're really focused on is, again, how do we get back to the doc and get them engaged in using the Awell platform and being able to see progress on their patient's care? The third major roadmap item for us is pre-intake communications. We're doing that with another platform today. It'd be great if we could just do it in an automated way with Awell. So that's on the roadmap. And lastly, again, with intake, patient experience is super important. We're very focused on patient engagement and running surveys to make sure we have the right approach. So that's all I had for the presentation. Happy to field any questions.